afternoon, Sir Rolly. Good afternoon, classmate. So for today's discussion, I'm going to discuss medical and allied professions. But first, what is allied health? Allied health professions are involved with the delivery of health or related services pertaining to the identification, evaluation, and prevention of diseases and disorders, dietary and nutrition services, rehabilitation and health system management, among others. Medical professionals is a group of individuals qualified to practice medicine. Kasama po dito yung mga doctors, nurses, hospice workers, emergency medical technician, and other trained caregivers. Allied health professions are lines of work that still deal with healthcare but are distinct from medicine. Healthcare provider or practitioner is a person who helps identify, prevent, or treat an illness or disability. An independent healthcare provider who is licensed to practice on and provide general and or specialized care to a specific area of the body. Allied health professionals is a trained healthcare provider practicing under supervision of a physician or healthcare practitioner. They include pharmacists, dental hygienists, physical therapists, and nurses.
Hi, I'm John Mark Layus, and I'm going to explain all of the importance in medical and allied health. Prevention. Prevention is to keep illness or injury from happening. What is prevention? Prevention activities are typically categorized by the following three definitions: primary prevention, secondary prevention, and tertiary prevention. Primary prevention: intervening before health effects occur through measures such as vaccinations, altering risky behaviors, and banning substances known to be associated with a disease or health condition. Secondary prevention: screening to identify disease in the earliest stage before the onset of signs and symptoms through measures such as mammography and regular blood pressure testing. Tertiary prevention: managing disease post-diagnosis to slow or stop disease progression through measures such as chemotherapy, rehabilitation, and screening for complication. Assessment or evaluation: appraisal of the condition based on the patient's subjective report. Assessment or evaluation: assessment is a broad term that is used to describe a process of measuring your health and ability to perform everyday skills during a hospital stay. Diagnosis: analysis based on the signs, symptoms, and laboratory findings. Diagnosis is the process of determining which disease or condition explains a person's symptoms and signs. It is most often referred to as diagnosis with the medical context being implicit. The information required for diagnosis is typically collected from a history and physical examination of the person seeking medical care. Treatment: management and care of a patient, combating of disease or disorders. Treatment: treatment depends on the type of mental illness you have, its severity, and what works best for you. In any case, a combination of treatment works best. Rehabilitation: treatment designed to recover from injury, illness, or disease. Rehabilitation is a set of intervention designed to optimize functioning and reduce disability, individuals with health condition, and interaction with their environment. Advocacy: a method by which a group of health professionals work together to develop programs. Advocacy is the process of promoting education, processes, and legislation that are designed to improve the general health of people living within a defined geographical location. The process of advocacy also involves identifying potential threats to the health of people living in the community and alerting others to the seriousness of those threats. Promotion of health and well-being: process of enabling people to increase control over their health and its determinants. Promotion of health is a behavioral social science that draws from the biological, environmental, physical and medical science to promote health and prevent disease, disability and premature death through education, driven, voluntary behavior change activities. Education, the process of sharing and gaining knowledge. Health education is a profession of educating people about health. Areas within this profession encompass environmental health, physical health, social health, emotional health, intellectual health, and spiritual health, as well as sexual and reproductive health education. Research, diligent inquiry or examination of data, records, and observations in a search for facts or principles. Health research also aims to find better ways to prevent and treat disease. Health research is an important way to help improve the care and treatment of people.
I'm Jimmy Israel Gutierrez and I'm going to report about that. Who are the medical and allied health professionals?
Who are the medical and allied health professionals? Audiologist. Sila ang tumutulong sa pagrehabilita ng mga may kapansanan sa panrinig. Clinical psychologist. Sila ang mga tumutulong para maiwasan ang mental disorder. Dietitian. Sila ang mga nagtataguyod ng mabuting kalusugan sa pamamagitan ng proper diet. Guidance counselor. Sila ang tumutulong sa pagkapasya sa nararapat na piliing karir ng estudyante. Health educator. Sila ang bumubuo ng kaalaman sa kalusugan, kasanayan sa buhay, at kabutihan o kagalingan ng estudyante. Massage therapist. Pinapagaling nila ang mga kliyente gamit ang pagmamasahe sa mga soft tissues, kagaya na lamang ng mga muscle. Medical assistant. Sila ay nagkatrabaho sa ilalim na pangangasiwa ng physicians. Medical technologist. Nagsasagawa ng mga iba't ibang gawain sa liquid ng katawan mula sa pagsusuri ng dugo. Midwife. Tumutulong sa pagpapanatili ng kalusugan sa panganganak. Occupational therapist. Sila ang gumagawa ng aktibidad para tulungan ang mga taong limitado ang kilos dahil sa mga pinsala. Paramedic. Sila ang nagbibigay ng emergency medical treatment at ng mga paunang lunas. Pharmacist. Nagbibigay ng iniresetang gamot. Radiographer. Sila ang tumutulong sa pag-X-ray, MRI at CT scan. Physical therapist. Sila ang mga gumagamot sa mga taong may kapansanan sa katawan. Speech language pathologist. Sila ang mga tumutulong sa taong hirap magsalita o bumigkas. Phlebotomist. Sila ang nagsasagawa ng blood transfusion. Radiation therapist. Sila ang nangangasiwa ng radiation therapy. Respiratory therapist. Itinataguyod ang cardiopulmonary health. Ang cardiopulmonary ay pumapatungkol sa heart and lungs. Social worker. Tinuturuan o tinutulungan ang mga tao na makayanan ang mga hamon ng buhay. Pediatrist. Sila ang eksperto sa pag-modify ng footwear para sa mga taong sumasakit ang lower limbs. Exercise physiologist. Sinusuri nila ang fitness ng kanilang pasyente at tumutulong sila na mapanatili nito ang magandang kalusugan.